How do you identify a splenic sequestration crisis in sickle cell disease? Imagine suddenly feeling very weak and noticing your child's abdomen feels unusually firm or swollen on the left side. These are key clues that something serious might be happening in sickle cell disease. A splenic sequestration crisis is a sudden, dangerous event where sickled red blood cells block blood flow in the spleen, causing it to enlarge quickly. This can trap a large amount of blood in the spleen, leading to a sharp drop in blood volume and hemoglobin levels. Because of this, the body struggles to get enough oxygen, and the person may become very sick very fast. One of the clearest signs is a sudden enlargement of the spleen, which can be felt as a firm, enlarged mass in the upper left part of the abdomen. Caregivers are often taught how to gently feel for this change, especially during illness when the risk is higher. Along with the enlarged spleen, you might see sudden weakness or extreme fatigue because the body is losing red blood cells rapidly. The skin and lips may turn pale, reflecting severe anemia. The heart beats faster to try to circulate blood more efficiently, so a rapid heartbeat or quick breathing can also be signs. The child may complain of pain or tenderness on the left side of the abdomen where the spleen is. In severe cases, signs of shock may appear, such as cold hands or feet, low blood pressure, or even confusion or loss of consciousness. These are signs that vital organs are not getting enough blood and oxygen, and emergency care is needed immediately. Because the spleen traps blood, the overall circulating blood volume drops quickly, which can be life-threatening if not treated fast. This crisis mostly affects young children with sickle cell disease but can also happen in older children with certain sickle cell types. To identify it early, caregivers should regularly check the child's abdomen for changes in spleen size, especially during illness. Watching for sudden weakness, pallor, abdominal pain, or rapid heartbeat is crucial. If any of these signs appear, urgent medical attention is necessary. Diagnosis is mainly based on physical examination showing an enlarged spleen and symptoms like weakness and pallor. Blood tests will often show a sudden drop in hemoglobin and red blood cell count. Sometimes, an ultrasound is used if the spleen cannot be felt easily. Treatment involves quick hospital care, usually with blood transfusions to restore blood volume and prevent shock. In cases where this crisis happens repeatedly, removing the spleen surgically might be considered. Recognizing a splenic sequestration crisis early by noting sudden spleen enlargement and symptoms of anemia and circulatory problems is vital. Prompt medical intervention can save lives and prevent serious complications. Always consult healthcare professionals for personalized advice and care.